Today, we're diving into a condition that's as serious as it is invisible, the intracranial aneurysm. Now, I know that sounds complicated, but stick with me. We're going to break down the story behind this hidden risk, from what it is to the warning signs and how doctors fight back. So let's start with a pretty startling fact. What if I told you that a potentially deadly condition is hiding right now in as many as 1 in every 20 people? Most of them will never even know it's there. This isn't a movie plot, it's a medical reality, tucked away inside the blood vessels of the brain. So, what exactly is this thing? Well, you often hear it compared to a time bomb. And honestly, that's a pretty good way to think about it. It's this tiny weakness that can sit there for years, totally silent, but it holds the potential for a sudden, absolutely catastrophic event. Okay, so here's the official definition. An intracranial aneurysm is basically a weak spot on the wall of an artery in your brain. The best analogy? Imagine a weak spot on a tire or a balloon. As blood constantly pumps through, it pushes against that weak area, causing it to bulge out and fill with blood, creating this little balloon-like bubble. Now, not all these bulges look the same. They really come in 2 main flavors. By far, the most common is the saccular type, which everyone calls a berry aneurysm. And you can see why. It looks just like a little berry hanging off the side of the artery. The other kind, which is less common, is called fusiform, and that's where a whole section of the artery just kind of swells up all around. For most people, an unruptured aneurysm causes 0 problems. It's totally silent. The real danger, the moment that time bomb goes off, is when it bursts. And when that happens, the signs are dramatic, and knowing them can literally be the difference between life and death. This is the absolute hallmark symptom. It's famously called a thunderclap headache. We're not talking about a slow-building migraine here. This is a sudden, explosive pain that people describe as, without a doubt, the single worst headache of their entire life. It hits you like a bolt of lightning, and it's a massive red flag for a medical emergency. And along with that absolutely devastating headache, a whole bunch of other scary symptoms can pop up. Things like sudden nausea and vomiting, feeling confused or super drowsy, having vision problems, or even passing out. If you see this constellation of symptoms, it means one thing and one thing only: get to an emergency room right now. And here's why that speed is so critical. The statistics are just incredibly sobering. Around 60% of people who have an aneurysm rupture die from that initial bleed, many times before they can even make it to a hospital. I mean, the stakes just don't get any higher than that. So this all leads to a really important question. Why? Why do these weak spots even form in the first place? And while it's true it can happen to anyone, there are some very clear risk factors that can really increase your odds. What's so interesting here is that it's a mix of lifestyle choices and pure genetics. Things like high blood pressure and smoking are huge contributors. They just hammer away at your artery walls over the years, weakening them. But at the same time, your DNA plays a massive role. If you have certain genetic conditions or if aneurysms run in your family, your risk goes up significantly. All right, so let's shift gears. If an aneurysm is found, especially after it's ruptured, the immediate goal is to make it safe, to stop it from bleeding again. And for years, medicine has had 2 very different but very effective ways of doing that. The 2 big options are clipping and coiling. Clipping is the old-school traditional method. It's open brain surgery. A surgeon goes in and places a tiny metal clip right at the neck of the aneurysm, sealing it off from the outside. Coiling, on the other hand, is the newer, much less invasive technique, where doctors go inside your blood vessels to fix the problem. Let's just walk through coiling for a sec, because it's an incredible procedure. A tiny tube, a catheter, is inserted into an artery in your leg. Then it's carefully threaded all the way up through your body into the super delicate vessels of the brain. Once it's right inside the aneurysm, the surgeon pushes out these tiny, soft platinum coils. They fill up the balloon, causing the blood inside to clot. And boom, the aneurysm is sealed off from the inside. Pretty amazing. Okay, so you've got 2 main options. One is more invasive, but maybe more permanent. The other is way less invasive, but has its own issues. As you can imagine, this has created a huge debate in the medical world. Which one is better? And that debate really revolves around one specific major study. And that study is the International Subarachnoid Aneurysm Trial, or ISAT for short. This thing was a massive undertaking to compare clipping and coiling head-to-head in patients with ruptured aneurysms. And what it found pretty much changed the game for how doctors approach treatment. So, what did ISAT find? Well, it wasn't a simple, this one's better. The study showed that coiling had better short-term results, fewer complications right after the procedure. But long-term, coiling had a much higher chance of the aneurysm coming back and a way higher need for a second treatment down the road. So you see the dilemma, right? There's no single best choice. It all comes down to the patient, their health, and the specific details of their aneurysm. And that leads us to the big challenge today. Our imaging technology, things like MRIs and CT scans, are so good now that we're finding more and more of these unruptured time bombs by accident. And this creates a huge ethical puzzle. We know that many of these will never, ever burst. So how do you decide who needs a risky brain procedure and who is actually safer just leaving it alone? That is the profound question that doctors and patients are wrestling with every single day.